UnitedHealthcare denies claim of woman in coma.
Yeah.
In a coma.
Yeah.
And so this gets even more interesting because many Americans have expressed frustration with the health insurance system, which was brought into focus when UnitedHealth CEO Brian Thompson was shot and killed in New York, allegedly by Luigi Mangione, who has been charged in connection with the homicide as awaiting trial. Mangione pleaded not guilty to murder and weapons charges. Where this gets interesting is there is a post that was put out there by I think he's a surgeon.
It's a doctor.
Dr. Levy. And he said, this is his tweet: UnitedHealthcare just denied a claim on one of my patients in the ICU with a brain hemorrhage, in a coma, on a ventilator, with heart failure, because I haven't proven to them that caring for her in the hospital was medically necessary. Tear it all down. From Zachary Levy, MD.
Yeah, I've said it before. Doctors are not keen on having to negotiate with bean counters to get what they want for their patients. I know this.
Jen, please, if you could share with the audience, your husband is a urologist. How does he feel about the for-profit health system that he has to deal with on a regular basis?
Okay, I will say this, and I don't, when the whole thing went down with Brian Thompson, the only thing that Jason had to say about it really was that he had wished it was Humana.
Oh man,
because that's the one. That's the one he's got bigger problems with. But that was his response to the situation. He's like, I wish it had been Humana. But anyway, so that's how doctors feel about it. Doctors feel like they spend an inordinate amount of their time, money, and space dealing with managed care. And it's not just also, it's also very demeaning, by the way, for doctors who have studied and know what they're talking about and are trying to do what's best for their patients to have to spend their time arguing with insurance companies to get what their patients need for them. It's demeaning because these are people that actually trained and went to med school and know something. They know a thing or two. And when they have to sit there and argue with someone who knows nothing about medicine based on whatever is in their handbook, and this is, again, the problem with managed care, but doctors do not appreciate having to fight and waste their time fighting with non-doctors over what's in their patient's best interest. And I will say doctors can get uppity about it, but you know what? This is the one case where I kind of support them in their uppityness.
Well,
if I went to medical school, why am I sitting here arguing with some friggin' accountant about what my patient needs? And that's what it is for them.
Well, not only that, but let's be honest. They try to take away the humanity of a lot of doctors. Most doctors want no part of this.
No.
And nurses especially want no part of this. When you are a doctor, whether you're a pediatrician, an optometrist, heart surgeon, whether you're, an at-home, in-home care nurse, these things are very personal for people. And in many ways, it's the I don't want to say it's like the Florence Nightingale type circumstance, but there is this caretaker mindset that comes into play where you are a doctor, you are a nurse, you are taking care of these people. This is very important. This is life-changing in many ways. Now, are there doctors that like to play God? Absolutely. But that's an anomaly. Most of them are there because they want to serve humanity. They want to help. And that is the key. And can you imagine what it's like being a doctor, knowing that you've gone to such lengths to try to help somebody with a chronic disease or injury, and then the next thing you know, they are told by the for-profit insurance company or the big pharma profit company that, no, we can't give this to you. Or if we are going to give it to you, we're going to make it so damn expensive, we're literally going to put your person on the street.
Do you want to know which doctors actually do kind of like it? Because there are doctors that like the system. There are doctors that like it. And again, Jason would never name names or say things, but there are certain doctors,
any doctors that are connected to the pharmaceutical industry that make money off of giving prescriptions.
Not just that. It's not just that. Okay. So there's a lot of different things. So a lot of practices, and there unfortunately are a couple urological practices down here, where the doctors are known amongst other urologists for basically getting every unnecessary thing you could possibly think, overbilling, overcoding, overcharging, all of those kinds of scams. And there are doctors, unfortunately, like any other profession, that are unethical. And so to those doctors, this system works because they're able to rate it. They're living high off the hog from it. But doctors who are legitimately, genuinely concerned for their patients' well-being are sick and tired of arguing with non-doctors as to what their patients need. That's what I have grown used to hearing. So,
and Australia is one of many countries, Cam.
And it's not perfect, but it's a hell of a lot better than what we have.
What system is perfect?
None.
We definitely need a system where being healthy is a huge part of how you do reduce a lot of the problems that exist within the system. But make no mistake, we are not a healthy culture by any stretch. In fact, we are the fattest country in the world. So that's not a mistake.
Isn't that amazing? And here is what is so frustrating about it. Not only are we the fattest country in the world, but the profiteers that now profit off of the fatness in every single direction, whether it's the diabetes meds or the Ozempic people, or even certain specialized whatever clinics for fat removal, whatever it is. Like, it's so gross. But what's so pathetic about it is that it isn't just a matter of diet and exercise. You've got countries like in France, they eat way more cheese than we do, right? Like, sure. There's countries and places that what they eat is not necessarily low-fat food.
But you have pointed
it's not processed and poisonous.
And you've also pointed out the quality of the soil in other parts of the world.
That, and they also generally, and this isn't everywhere, but kind of, they walk.
They do.
We drive. So we have so many sedentary, we're much more sedentary, but our food is allowed to be poisoned. We've talked about this before. So what, for example, in other countries, and I don't know if people know this, but in other countries, they don't refrigerate eggs.
No.
They don't refrigerate eggs. And this is something that I really do care about, because I've had non-refrigerated eggs in place, and it's much better, people, I'm telling you. But in this country, we have to refrigerate our eggs. And why is that? Do you know why? Why do we have to refrigerate our eggs?
I mean, the only eggs I've ever known that I never refrigerated was when I did live.
But do you know why we have to refrigerate our eggs in this country?
I'm not 100% sure. The only eggs I know that don't need to be refrigerated are eggs that come directly from the hen. And, if you have a coop. And
right. Right. But here's the problem. In this country, our eggs, like eggs at supermarkets, are treated with chemicals and bleached so that their shells are weakened and will absorb bacteria. Whereas if you just left them the hell alone, then they wouldn't have to have that issue. So when you're in a country like Costa Rica, from anywhere from Costa Rica to France to Italy to wherever, and you're in a market, you'll see the eggs in a basket on the counter by the register. You're not going to see them refrigerated. And even in places in this country, and this is annoying, this is one of those annoying things that I have learned, even in places in this country that don't need to refrigerate their eggs. Like, so for example, the tailgate market in Asheville, when I would go and people literally just collected their eggs that morning, whatever, they're still legally required to keep those eggs refrigerated. Now, a lot of them don't, because we know that it's stupid and not necessary. But so we create laws to basically enforce unnecessary laws that poison our food.